Welcome to The Doctor Will Hear You Now, a podcast featuring our physicians and other healthcare providers telling their stories, sharing glimpses into their daily work and mission, and showing what it means to practice medicine just a little bit differently. Healing you means hearing you. Let's talk. I'm Lexi.
And I'm Ben, and today we're joined by Dr. Harry Hawthorne, a primary care provider with St. Francis Medical Group in Monroe. So now this conversation was all about the importance of primary care and why you need to have an established relationship with a primary care provider. I think one of the things that I took away from this conversation was the contrast between maybe seeing someone at urgent care versus having that established relationship already with a primary care provider. The doctor that you see at urgent care and the doctor that you see in primary care, they're going to have the same training, they're going to have that same background, but the difference is that if you're going to urgent care frequently, you're probably going to be not seeing the same doctor each time. So you're having to retell your story and reestablish that connection and having to go through that experience each time. Whereas with your primary care provider, you've already got that rapport, you've already got all of that info shared from previous experience. And so you can kind of go in and just get right to it and get right to what you need to really be talking about that day. So Lexi, I'm curious from you what you took away from this conversation with Dr. Hawthorne.
Yeah, Ben, you made some great points. And I think my biggest takeaway is kind of related to yours in that he really talked about the importance of that relationship and how having that relationship with him, if you go to him or any primary care doctor or provider, is that they're listening for these underlying things because they know you, they know your story. And so as you'll hear, he shared about someone who came in worried about, they felt like they had memory loss and they thought they were, prematurely aging and dementia. And what he really heard from that and was able to point them in the right direction was, it sounds like maybe you're stressed or you have a lot on your plate, and that can all be symptoms of anxiety and other kind of mental health focused things. And so that's really was the biggest takeaway for me, is just how he's listening for what's not said. And I think that was really important takeaway from what you can get from being established with a primary care provider.
For sure. Well, it was a really good conversation, and I'm excited to get into it. Are you ready, Lexi?
I'm ready. Let's go.
All right. Welcome, Dr. Hawthorne. We're so glad you're joining us today.
Thanks for having me.
Can you start, I guess, by telling us a little bit about yourself and your work at St. Francis and maybe how you decided to get into primary care?
It's a little bit ironic. When I went to med school, I was gun-ho surgery. Did not want to do primary care, wanted nothing to do with it. Then I kind of fell into the lap during a rotation of a primary care doctor up in this area and loved it. Fell in love with it after the first day. The relationships you get to build with patients, and you never know what's behind door number 1, 2, or 3. Everything's a little bit different, so it's been quite enjoyable.
And so you are board certified in family medicine, correct?
Correct.
Okay. So tell us a little bit more about that specialty, and are there any differences between receiving primary care from a family medicine doctor versus an internal medicine doctor or something similar to that?
Sure. There's not much difference between an internal medicine doc versus family medicine and primary care. The main difference between internal medicine and family medicine, I would have to say, is that family medicine gets more women's health training than internal medicine does in residency. And that would probably be your main difference.
And what about from the patient perspective of if they're looking to see a family medicine doctor versus an internal medicine doctor? Is that experience different? What's the difference there for them and how they would encounter that different types of providers?
Probably wouldn't notice much, to be honest with you. And I would like to say also, moving back, another difference is family medicine does see children as well. Depending on what your training is. For me, 2 days old to death and everything in between. And so as from a patient perspective, probably wouldn't notice any difference.
Yeah, and so I guess really from what I'm hearing from you is that you see people from all walks of life. And so you're likely caring for multiple generations within one family. And so can you share a little bit about why family medicine and primary care is so important, no matter what age you are, whether you're that kid, right? You're kind of middle-aged or teen years on to when you're, in an older age group. Why is it so important to have a primary care provider through every walk of life?
I'm glad you brought that up because for me, it's pretty special when you can see grandpa, mom and dad, and kiddos. You see, hey, Mr. Jones, how you doing? How the kiddos? Oh, you're at the ball game, and you get to know the whole family and know everyone's story, which is pretty special. It is very important because we get busy with life, right? And thankfully, most people are healthy and you don't have to worry about it. Sure, there's the occasional cold or cut yourself, need me to stitch you up. That's all well and good. But what's so important about having a primary care doctor is that we're looking for your screening stuff, right? And so what I mean by that is looking for problems that are there that are not giving you problems yet. Because when you catch an issue early enough, it's much easier to fix it before it kind of loses control on you, right?
Definitely. And I would say, sometimes to your point about the younger generations and maybe even sometimes that men, right? They don't feel they need that PCP, especially when they're younger, because you feel invincible. Even as women, you're young and you're like, nothing can happen to me. I'm not going to get sick anytime soon. What would you say to that person who feels that way? Would you encourage them to take the step to find a PCP?
That person's probably right. They won't be sick anytime soon, and that's great. We're thankful for that. But the issue is that sooner or later, we're all going to cross that bridge where something happens. And when you have to have that help that you need, would you want it coming from someone who you are meeting for the first time or someone who's known you for years and knows what your story is?
Okay, so you talked a little bit about this just now, that person who, like you said, maybe they're fairly healthy. They catch a cold every now and then. What would you say to that person about the issues that come about when you're just going to urgent care, when you're just going to the emergency room, or you're just Googling those symptoms online and figuring out how to do it yourself?
Urgent cares have their place. They are needed. But there's a lot of things that go into it, even if you don't have a lot of complex chronic medical problems. It's, hey, I'm allergic to this or I'm allergic to that, or there's something when I was a kid that you completely forgot and mom and dad aren't there to remind the doctor, hey, this happened, we can't use this medicine. We remember what happened last time we did this? That doctor or physician's assistant or nurse practitioner is meeting you for the first time most times, and you're so much that goes into your medical history. It's life, right? It's your life, and it's okay if you don't remember everything, but that's what you pay us for, is to keep up with all that so you don't have to.
And you mentioned too those sort of chronic conditions that you might want an established primary care provider to sort of walk with you through and kind of help guide you through early on so you can kind of manage those conditions. Can you talk about a couple of examples of those types of chronic conditions that a PCP can maybe help you with?
Absolutely. So I would say our bread and butter is high blood pressure, high cholesterol, diabetes. Those are your big three. See it all day, every day. And it's something very important to keep in mind is that everyone's different, right? Just because a treatment plan worked for one patient doesn't mean that same one is going to work for a different patient. It can sometimes be a road that you have to trial and error or look at the whole picture, right? And I'm thankful for specialists. We need them, but you think about it, your cardiologist, he's worried about your heart. Your nephrologist, he's worried about your kidneys, all right? Your endocrinologist, she's worried about your thyroid. What we're here at primary care is to step back and look at the whole picture and say, okay, yes, you have high blood pressure, and we need to start you on this medicine, but that medicine might not play well with your kidneys, and so we can't do it, so we have to do something else. It's taking the whole picture together and finding a treatment plan that works just for you.
I think that's interesting because it's that trusted expert, right? Of I don't know what's best for my thyroid versus my kidney, and it's a lot of things to keep track of. And so I really like how you phrase that of you pay us to keep track of it for you, right? And all the things that worry you. And it's similar to how you would do with work of, I need to prioritize my kidney function over this. And you can kind of make that call and help give that direction.
Absolutely. And it's also important when you can have that trust and you can just listen to the patient is, you might say, from a doctor standpoint, you might look at blood work or a test and say, this is an issue, we need to fix this, but that's not what that patient came to you to say, to be seen for, right? That you need to hear what their priority is and work with them like, hey, I hear you about you're here for this, but you actually had this other issue that's more important, that's going to be more dangerous, that we need to fix that, right? For example, patient comes in worried about their weight. Yes, we need to lose weight. We could all lose a little bit of weight, right? I mean, that's everybody. We're going to get there, but what you don't know is that now you have diabetes or high blood pressure, and we need to work on that, get that controlled, and then while we work on the weight, or we can put the weight on the back burner for right now, not forget about it, but the beauty of primary care is that when you build those relationships and you have that trust, you can work with the patient to get them to be the healthiest they can be so they can get back to enjoying their life without having to worry about these chronic conditions.
Yeah, I think that's important to remember too, because it sounds like you're listening for a lot of the underlying things, right? Of, oh, you might have this weight gain, but what are things that are triggering that? Or you have, you're having these heart troubles or soreness in muscles and things like that. And as a primary care doctor, you're listening for what else could be happening. And I think that's so important for young people to even consider with getting established with a primary care, because there's things like mental health and anxiety that can cause stress, can cause a lot of health issues. And so I can imagine that you are, in the questions you're asking and in the way that you're connecting with your patients, you're trying to listen for some of that to help even screen and manage on how you can help them work through that and not be so stressed, not be anxious. Can you talk a little bit about how you help even with those, I guess, more what we consider mental health focused stresses and anxieties and health issues?
I'm glad you brought that up because it does tie into what we're talking about, listening for the underlying reason of an issue, of a symptom. This happened a couple of times this week. I've had elderly people come in, hey, I'm worried about my memory, I'm worried about my cognition, forgetting people's names. Well, to be honest with you, most times it's a mood problem, depression and anxiety. You don't want to jump to dementia or Alzheimer's or anything like that. High school, college kids come in, hey, I can't focus, I can't study, I think I have ADD. You might, but also you might just be very stressed. And what does stress do? It causes us to lose the ability to focus. Hey, depression, sleep, can't enjoy things you like to do, you can't concentrate. Just because it might sound like something, it's actually something else. And most people, by far and away, present to their primary care physician for mood disorders well before they go to a counselor or a psychiatrist or a psychologist. So it's something that I feel like as a community, that we are medical community, that we're getting better at finding. They published the numbers that the rates of depression and anxiety are increasing and rising. That might be true, but and this is just my personal opinion, so take it with a grain of salt, I think we're getting better at looking for it. I think it's always been there. We're just getting better training, feeling more comfortable talking about it, bringing it up. It's starting to lose that stigma of, hey, toughen up, pull yourself up by your bootstraps. No, we're talking about a chronic condition. We're talking about something wrong with your body, just like we don't shame anybody for having high blood pressure. We don't shame anybody for having diabetes. No, you got a problem, let's fix it. Let's work on a treatment plan for you that will work, and let's bring it up. Let's talk about it. It can be uncomfortable. It can be. But when you do that, you can actually take that step forward to where you can get to a better, healthier life, mentally and physically.
I love that you shared that, because I think it's something that people maybe are scared to bring up at a doctor's appointment because they think it's not the right place, it's not the right time. But I think it's also something that even outside of a physician's room or at an appointment, people they're noticing more in themselves of, oh, I have a lot on my plate, or yes, I'm stressed, or, and it's good to know that these are things that people can come to their doctors and their providers with, and they'll get help in managing that.
It's a very important part of life. It's something that we often sweep under the rug and hide behind, but it affects most people, believe it or not.
Primary care is personal. Good health starts with a provider who listens and gets to know you.
Connect with a provider who is ready to hear your story. Visit findmypcp.com.
Well, I want to switch gears a little bit. I know we talked about urgent care, and we talked about urgent care providers and primary care, and definitely agree that there is a space for that. I wanted to dive a little deeper in, is there a difference between a doctor you would see at urgent care versus a primary care doctor? Are there any differences in specialty or training, or really what's the difference in that connection point between urgent care and primary care?
Physician preference. Urgent care is a little bit more kind of, you go between clinic and ER, right? And so for me, something special that I enjoy about my job is that building those relationships. That doesn't mean everybody is that way, and that doesn't mean it's wrong. It's just some people are like, I want to see this person, I want to find out the problem, treat it, move on to the next problem. And so it depends on what the physician is looking for, whether they want to go into primary care or urgent care. But as far as medical training, nothing.
Yeah, and so I guess diving a little deeper into what you said is, with urgent care, you would get treated and kind of move on. And let's say if you had to go back, I guess you're not necessarily guaranteed to see the same doctor or physician that you saw the first time you went, right?
That's correct.
Yeah, and so what I'm hearing, it sounds like primary care, you go to the same person every time. And so that's where that relationship's really important for follow-up symptoms or symptoms that trigger other things that get worse if they're not treated right, or sometimes things just progress.
Absolutely. And to circle way back around, whilst explaining that it's good to have that relationships, for someone to know your history, is you come in, hey, I've got this bad infection. Well, 6 years ago you had the same one and we had difficulty with it. Well, we finally found out what worked for you. We're just going to start there and not cycle through those things we normally would. And it's, again, knowing that history is important.
Because it really saves you time.
Absolutely.
And that's a good point, I think, that we're making here for the listeners and the viewers too, is that it really is an investment in not just your health, but your time, your money. It's a financial investment too, because you're taking care of these things early, as you said. So that's a good point there.
Absolutely. It's easier and cheaper. If, for example, one of our biggest issues as a country right now is our obesity problem, right? And that's another word no one wants to hear, obesity, because there is a stigma. It's associated with, more, less desirable looks. It's associated with more adverse events with your health. Well, we can wait for your obesity to create problems like diabetes and kidney problems and blood pressure problems and joint problems and yada, 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 right? Or what we can do, instead of waiting for that to snowball on us, let's focus on this. Let's get our weight down in a safe, healthy manner. And not necessarily for vanity's sake, but just for your health's sake, right? And so that way we're not having to throw 4, 5, 6, 7, 8 pills at you to where you're going to take every day. Nobody wants their life to be just pills over and over and over and over again. So a lot of these pills can be $200, $300, $500 a month. That's a lot of money for a lot of people. Whereas if we focus early on what's causing the root issue, fix it, then you save yourself money, time, and years off your life, right?
Yeah, 100%. I would say, just kind of circling back to where you started there, of people who are concerned just about their weight. Do you feel like, I guess, what would you say to those who are maybe scared to come to their doctor with that question or that concern? Are there things that you do, would you see with your own patients, to encourage them to share what's bothering them no matter what, even if it is something as sensitive as weight and nutrition?
First thing I would tell them is that you're not alone. And that's not to say that you don't have a problem or that your problem is trivial. Most people deal with issues that they feel like they are alone, that they're the only ones that feel this way, and they're not. All right. losing weight is hard. If it was easy, we wouldn't be even having this conversation. It's one of the hardest things you can ever do. And facing the realization that, hey, I am not as tough as I thought I was. I am struggling with depression, anxiety. That's a big first step. It's a tough step, but again, you're not alone. That's what I see most often, to be honest with you. And find someone that you can trust, that you can actually feel open about talking about these problems, who's not going to judge you, who's not going to shame you for having these thoughts, these feelings, these problems, and work with you to develop a plan to fix the issue.
Well, also, I guess, how would you encourage our listeners to establish and maintain that relationship with a primary care provider? What's your advice for them?
I would start with asking friends, family, people you trust, right? If they see anybody, if you have that relationship with someone to have that conversation, is ask them and who they recommend. What do they like about that person? What do they don't like? What do they not like? Get online, look at reviews. No one's perfect. There's always going to be some bad reviews out there, but it's good to see the good and the bad, right? Because no one is perfect. And it's just, this guy's got bad reviews because there's long wait times. Well, but my friend sees him and says he spends a lot of time with his patients. Well, that might be why there's long wait times. And so it's just to ask around people that you trust and see what their experiences are. And then don't be afraid to swap. This is your body, your health. If you are not comfortable with somebody, you have every right to go get a second opinion, go see someone else. All right. It's so important to have that trust in whoever you are seeing, physician, assistant, nurse practitioner, doctor, whoever your primary care doctor provider is. You have to have trust in them. And if you don't, then there's nothing wrong with getting a second opinion.
Yeah, I think that's great advice. Okay, switching gears to a fun question here. We ask this to all of our guests. We like to hear, since it is a listening podcast and we're all about listening, what is something that you have been listening to lately? So it could be educational, it could be personal, fun, it could be about work. What's something that you've been listening to?
Mostly podcasts on how the Saints are going to do terrible this year. Yeah.
Oh no! About how they're going to be terrible.
Yeah, we're not good. I do like to listen to 80s rock a lot. And then my nurses make fun of me because I'm always listening to podcasts on medicines, the stuff that I like to do. There's several podcasts out there that deal with primary care, with critical care, with updates in hospital medicine. And I was listening to one on cholesterol the other day, and it popped up in my truck, lipidology, and I got a lot of grief about that because that's how I spend my extra time. But that's about it.
I think your patients probably appreciate that you're continuing your learning through every avenue. So don't let them give you too much grief.
Well, I think we're kind of nearing the end of our conversation, but we did really want to just kind of check to make sure if there's anything else that you think our our listeners, the audience would want to know about primary care that we haven't talked about. Maybe even some misconceptions or myths that we haven't necessarily covered about primary care that you'd want to dispel. That is an excellent question. Growing up here, and this is my own experience, if you will, I thought family medicine, primary care were, essentially glorified secretaries. And not to be mean about that is, hey, you have high blood pressure, you go see a cardiologist. Hey, you have anxiety, you go see a psychiatrist. And you just essentially kind of sort and shift people around. But from my own personal experience, it's so much more than that. And again, like when I said, from the very get-go, I was gun-ho surgery. I didn't want anything to do with this because I thought it was going to be boring. And it's not. It's when it's done correctly, in my opinion, it's very difficult. It's worth it, but it is a lot more than just shifting people around to specialists. It's actually making a difference in someone's life without sending them all over God's creation. Well, that was great advice. Thank you for joining us, Dr. Hawthorne. I think our listeners and our viewers will really enjoy hearing your advice and learning more about family medicine. So thanks for spending time with us. Really appreciate y'all's time and having me on. And listeners, thanks for tuning in. We'll have everything Dr. Hawthorne mentioned and other helpful resources linked in the show notes. And we'll be back soon with more episodes of The Doctor Will Hear You Now, a podcast from Franciscan Missionaries of Our Lady Health System.
If you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org. Thanks for listening.